It is a disease management care tool that enables people living with Parkinson's to track their symptoms, their medications. They can share their daily Parkinson's experience with their neurologist, with themselves, just to keep track of all of their symptoms so that we can have a personalized strategy ready for them. So it's all through the iPhone and Apple Watch. And what I think is really unique about StrivePD is that the user can explore all these interactive charts. They gain insights that reflect how they're doing. So all of that data is given back to the patient in a very digestible format. So, for example, if I add a medication for a patient to help control their dyskinesia or their off time, they can follow along on their graphs as the watch passively collects their dyskinesia data, and they can compare and trend out over time to show changes in their symptoms. So as a clinician, I know both subjectively how the patient's feeling, and I also have that objective data on how this medication is helping or if it's even causing more side effects than benefit. And another really kind of unique, interesting takeaway that I have found with my patients is that it really improves their communication with me. All of this data, all of their symptoms, these patterns and correlations that they pick up through Strive PD gives them this empowerment to come to clinic and ask the hard questions, or we look at all of their data. I've always thought that we have this unrealistic expectations of our patients for them to remember all their motor symptoms and all their non-motor symptoms and what medicines they take and how much they exercise and just life in general, for 3 to 6 months in between our visits. And so I think Stride PD really captures all of this data. It really helps them synthesize what's been happening in 3 to 6 months versus just remembering what's been going on in the last 2 weeks. So, it's very specific patient to patient. So they can log things that I've asked them to log, such as if they're having lightheaded or dizziness. I can look at when they take their midodrine and when they are experiencing this symptom, and we can make adjustments to their medications just to ensure that they're optimized and they're also safe. Um, and I tell my patients with Strive PD that this real-time objective feedback of their symptoms, their medications, their activities, it encourages them to stay on track. They see that maybe they haven't been as adherent to their medication schedule, or maybe they haven't exercised as much. So it really kind of points out what they should be doing day to day. And all they're doing is wearing their Apple Watch and quickly logging their meds. And I think that they're becoming this big active part in their disease management, and Strive PD is that care tool that allows them to do so.